First to our top story, a 14th resident has died in a Western Sydney aged care facility at the centre of a COVID-19 outbreak. The home's operator, Anglicare, has confirmed 76-year-old Ann Fahey died in Nepean Hospital yesterday. The outbreak at Newmarch House has infected 37 residents and 24 staff members, bringing the total to 61. The number increased by 2 yesterday after 2 more staff members were confirmed positive. Following calls for residents at the aged care home to be transferred to the public health system, New South Wales Health says residents can choose to stay in the home or go to Nepean Hospital to receive care.
Well, as some states begin to ease coronavirus restrictions, there are still 900 active cases in the country. A total of 6,700 people have tested positive since the outbreak began. 15 new cases were recorded yesterday, 5 in New South Wales, 7 in Victoria, 1 in Queensland. 2 people were diagnosed in the Northern Territory, ending its 25-day streak of no new infections. The national death toll currently stands at 93.
The Federal Education Minister has launched an attack on the Victorian Government for not reopening schools faster. The Commonwealth has been at loggerheads with the State Labor Administration over the issue. Federal Minister Nepean this morning says Victoria has taken a sledgehammer to kids' education. Let's get more on this. Our reporter Dan Conifer joins us from Canberra. Dan, how big an escalation in language is this?
Yeah, it's a big one, Joe, with Nepean, the Federal Minister, really taking Dan Andrews, the Victorian Premier, to task on the ABC's Insiders program this morning, saying, quote, "It's time we called Dan Andrews out for what the Commonwealth certainly sees as Victoria's sluggishness at outlining a plan to reopen schools or even reopening schools," saying that other states are already far ahead of Victoria, pointing to Labor governments in the Northern Territory and Labor governments in the Labor government in Western Australia, and saying that Dan Andrews needs to follow the national medical advice of the chief medical officers and the Commonwealth chief medical officer, and get kids back into the classroom sooner. Now, of course, the Victorian chief medical officer takes a different view, as far as we can tell, with the advice being for students not to return to the classroom. But Nepean says it's time that national medical advice was followed, and changing tack, if you like, as well, from what the federal government had previously been saying, which was in terms of when who you should be listening to, who parents should be listening to in terms of when to send their children back to school. It was that they should listen to state premiers and state and territory chief ministers. Now Nepean's message is very firmly listen to the medical advice, and the medical advice that he's pointing to is that national medical advice that says that kids and teachers are safe to return to school.
Dan, staying with education, the Commonwealth is also pressuring universities to reopen their campuses.
That's right. It follows the schools, tackling the schools issue and tackling the childcare issue as well, if you like, with Nepean saying that he wants university campuses to reopen to in-person teaching by July, and for the hundreds of thousands of students to be back in lecture theatres and back in classrooms once again. He's been in talks with the universities about this, and he's hopeful that they'll be on board with that timetable for a return in semester 2. Let's take a listen to some of what Nepean had to say.
The first thing we've got to do is get our university campuses here open for domestic students and for those international students who are here now. So my focus, like it is with schools, like it is with childcare, and now like it is with universities, let's get them open, let's get that education happening for those who are here and can avail themselves of it. That is the absolute key focus of the government at the moment.
Nepean there, and just lastly, Joe, on childcare education. Now, the people in that sector have been impacted by the downturn in enrolments and parents pulling their children out of early childhood education. But many of the workers in the sector are foreign nationals and therefore aren't eligible for the JobKeeper wage subsidy. Nepean in that interview there indicating that this was an issue that the government was looking at, and there could be top-up payments to providers to help them out and to help out some of those workers as well.
All right, Dan Conifer, we'll leave it there. Thanks for the update there from Canberra.
Meantime, Flight Centre has stopped charging cancellation fees for trips affected by coronavirus following pressure from Australia's consumer watchdog. The travel agency had been charging people $300 to refund international flights and a $50 cancellation fee for domestic flights. Flight Centre says the change will be applied retrospectively to bookings cancelled due to COVID-19 from the 13th of March.
More than 300,000 homeowners have been approved for a loan deferral on mortgage repayments since the COVID-19 pandemic began. Data released by the Australian Banking Association shows 170,000 business owners have also received a deferral on their business loan repayments. An additional $45 billion has been provided in new loans around the country.
The South Australian Government is easing restrictions on some public play areas. A letter from SA Health recommends councils reopen public parks, playgrounds and equipment. It says there is a minimal risk of contamination as the state has a low number of COVID-19 cases and hasn't recorded any new cases for 10 consecutive days. Now, the death toll has passed 65,000 in the United States overnight, and there are now more than 1.1 million confirmed cases. Meanwhile, tensions are continuing to rise across the country over ongoing coronavirus restrictions. North America correspondent David Lipson has more from Washington.
So 32 states now have started to ease the restrictions, even though there are still a very high number of infections and deaths going on across America, as you mentioned. And we saw in Stillwater, Oklahoma, for example, there was a restriction put in place that if you wanted to go into any of the reopened restaurants or shops, you had to wear a face mask. Now, within hours, shopkeepers had been threatened. There had even been one threat of gun violence. And as such, those restrictions for face masks were rolled back. We've also seen tensions in California because of the governor's decision there to impose restrictions on the beaches that were opened last weekend. We saw crowds head to those beaches, and as such they were shut down. And as such, there were protests yesterday and smaller ones here today as well. And here in Washington, D.C., there were fairly large crowds that turned out on the National Mall to watch a flyover display that was organised by the government here and the Defence Department as a sort of morale booster. But as a result, quite a large number of people gathering there too, even though this territory has restrictions still in place. So quite a lot of disparity between states, still significant tensions as well. In New York, which is still regarded as very much the state that has been hardest hit by this, there are more somewhat encouraging news coming out. We saw the total deaths, 299 yesterday, which is still an incredibly high number, but much less than the 800 or so we were getting every day a few weeks ago. And as such, the governor there, Andrew Cuomo, is very much thanking his voters, thanking those citizens of New York for abiding very carefully to those stay-at-home restrictions. Take a look.
They have closed down in a way that is just remarkable. You see that curve that dropped in the projections of the number of cases. That curve didn't drop. New Yorkers grabbed that curve and bent it down. That's what happened. That number was going like this. That's why all the projections were wrong. New Yorkers grabbed it, pulled it down.
That New York Governor there, Andrew Cuomo. Now, as we understand it too, David, the White House has blocked senior infectious disease official Anthony Fauci from giving evidence at a congressional hearing. What's their justification for this?
Yes, well, Anthony Fauci is the top infectious disease expert, the top infectious disease official advising the White House. He's very widely respected and has gained a very high and trusted profile throughout this crisis. And indeed, everyone now in America knows him, knows his name. He's also at times been fairly frank in some of the advice that he's given, and some of it has gone against what the President Donald Trump has been saying at the time. Well, the House Democrats who control the lower house in Congress, want to call him before a House Appropriations Committee. The White House has said no, that's not going to happen. The justification is that it would be counterproductive, they say, for him to appear at this time of crisis when he is trying to advise the president on dealing with an unfolding situation. But he has, it seems, been allowed to give testimony before the Republican-controlled Senate a little later this month. So as such, the Democrats are claiming that this is partisan politics being played at a time of a health crisis and an economic crisis. But we will see how that unfolds. The White House is saying that they will allow him to testify, to give evidence, but just not at this time.
Figures in the United Kingdom, though, show hundreds of people are continuing to die each day as a result of COVID-19. In a daily news conference in London, British Minister Robert Gendrick says the figures are troubling.
And sadly, of those tested positive for coronavirus across all settings, 28,131 have now died. That's an increase of 621 fatalities since yesterday. These are heartbreaking losses for every family affected, and all our thoughts and prayers are with their families and their friends.
The French government has announced plans to extend its national emergency declaration until the 24th of July. The country's health minister says it would be premature to lift the state of emergency, which started on the 24th of March. France has recorded more than 168,000 infections and more than 24,000 deaths.